Hi guys, welcome back to my channel. So this is the part 2 of my previous video, the pregnancy video.
The first week doesn't start from the day you had sex or the day you found out you were pregnant. No,
because when I went to do, after finding out I was pregnant, I went to the hospital to do the blood test. The results came and I was like 4 weeks pregnant. Yes. I was like, wow, how come I was 4 weeks pregnant?
Yes. So because we don't know when you conceive, we want a standard. So we use your last menstrual period. So you may not necessarily be 4 weeks pregnant, but because we want a standard, we use your last menstrual period. So from your last menstrual period to the time you are testing.
Yes.
So normally when a woman tests positive, we say you are 4 weeks pregnant already. Okay, already.
Interesting.
Yes. So for the first trimester, your stomach is still flat. You don't expect a very big stomach because your baby is still very tiny, very tiny. So don't expect to start come and say you feel your stomach is your belly fat. It's not any baby.
Blame the innocent baby.
Exactly. So you may experience all the symptoms we spoke about: your morning sickness, your fatigue, your mood swings, headaches, cravings. You may be craving things you don't like usually craving ice cream at 2 a.m. That's
I was taking this milk. Even milk.
Okay.
Hey! Meanwhile, there's no taste inside that milk. I was just taking it myself.
Yes. So your first trimester may go unnoticed.
People like me, you notice it well.
People who don't know.
People who don't know. Hey,
yes, so as I said, it's different for everyone. Yours may be very different from this. So don't expect it, or when it comes, don't think. Yes.
There's another thing, but when we get there, I'll talk about it. People will be comparing your pregnancy with someone, which is very bad.
Very different. I don't think there are any two pregnancies
that are the same. Even with the same person, I think when I'm pregnant again
it will be different.
It will be different.
Very different. Exactly. So let's talk about the second trimester. So the second trimester, we said, is from 13 weeks to 26 weeks. So at this point, your baby is now growing. So you will experience or you see a baby bump. That's a small, nice bump on your stomach. Yes,
that's
exactly.
If you are cute, if you are obedient, like someone like me.
Yes, and in the second trimester, your symptoms may reduce, may lessen. So the nausea may go down and everything. And this is the time you start experiencing weight gain. So you put on some kilos. But then we want your pre-pregnancy weight to be like between 60 and 70 kg.
Okay,
pre-pregnancy. But because when you get pregnant, you increase. But we don't want your pregnant weight to exceed 90 kg. It's more.
Even at the end of the third trimester,
yes, it shouldn't exceed 90. It increases the chance for many things. So hypertension. If you are obese too, it's plenty problems. Yes. So as we said, and then the second trimester is when you would expect your baby to kick. So this occurs from 16 weeks onward. So from 16 weeks, you should start expecting your baby to kick. And at the hospital, we refer to it as quickening. So the doctor asks you, have you had your quickening? So
your stomach will be there, right?
Yes, that's what you experience your baby kicking. And I think that's the most interesting part of the whole pregnancy.
Do you know what funny thing? After the pregnancy, you can't remember. You want to remember how it felt like, but you still can't remember. I don't know if people will remember, but me, I can't remember, but I know it was just a wonderful feeling.
You may experience in the second trimester.
So guys, please, if you had a different experience or something, or you have some experiences you want to share with us, just let us know in the comment section down below.
Okay, so let's continue. So other symptoms include darkening of your abdomen. There's a dark line. It's called the linear nigra. So you see a dark line from your.
So it is nice. That thing is nice. I remember my husband used to ask me, so I don't like he watched this video, he said I'm exposing him. He will go and do his research and then be asking questions. When he researches and he knows that maybe in week 22 you have to do this, then he'll call me. Now, so are you experiencing this? Yes.
Husbands are involved in pregnancy. Makes it so husbands, please be involved. Okay, it's a lot of stress.
And they're crying, they will cry. They just have to give us 20 money when we are pregnant.
When she cries, just like
give me money. And I'll stop crying.
Aside the linear nagra, you can have darkening of your nipples. Your nipples get dark.
It's true.
Let's increase melanin. It's melanin is what gives you a dark skin color. In the second trimester too, you may experience swelling of your feet. Please, this is not, and that's where your aunties will tell you that you are getting twins. It's good. You are.
Just that pregnancy.
We don't want you to have swollen feet. The sign of preeclampsia, which is increased blood pressure, and that blood pressure is not good for your baby. We can have something called intrauterine growth restriction, so the baby is smaller than usual because the baby is not getting enough blood. Okay. But if your blood is in normal pressures, it can flow normally to the smallest capillary that your baby needs.
During antenatal, they always check your blood pressure. So don't be excited when you see that your feet are swollen. You should go to the hospital and check your blood pressure and get it regulated. From the second trimester also, as you advance in the trimester, your bump increases and increases, and this is the time the baby is getting bigger and bigger. And there's one artery in your body. It's, you know, the aorta. Do you know the aorta? You want to come and disgrace me on this channel? Okay,
so there are major vessels in your body, okay, that run from your heart downwards, and there's one called the abdominal aorta, okay, and it has branches to various places, okay. But then as your uterus is expanding and expanding, the weight of the uterus can fall on these arteries and reduce the blood supply. That's why as your stomach gets bigger, you're advised not to lie on your back, because when you lie, so let's say the artery is down here, and when you lie on your back, the baby or the uterus falls on that artery and compresses it, so it reduces the blood supply to the placenta and to you yourself, the rest of your body. Exactly. So as your baby increases, it's advised that you lie on your left side. Whenever you're sleeping, lie on your left. From the second and third trimester, you realize that you pee more often.
Yes.
That's because of the size of the uterus that sits on your bladder. So it makes you,
hey, I'll wake up and pee.
So the bladder is like when something touches it, when it's full, it gives you the signal that I want to pee, so you go and pee.
But this time, before I get back to the bed, I want to pee again.
Yes, but this time your bladder is not so full, but then something is sitting on your pressing on your bladder, so your bladder thinks that it's full, so then time to pee. So you go and pee, and then something small, because the bladder actually is not full, but then because something sits on you, think you want to pee. So expect those things in the second and third trimester. For the third trimester, it's the same things we've talked about. The peeing more frequently, difficulty, but also you can have difficulty breathing because there's something under your rib cage called your diaphragm. That's what you use to breathe.
There's so
in
much pressure
and out, in and out. So when the big uterus is compressing on the diaphragm, you find it difficult breathing because your diaphragm can't relax fully because there's someone there. Third trimester, you may experience some contractions. We have true contractions and false contractions. Some contractions we call Braxton Hicks. We spell it there for them. It's called Braxton Hicks contraction. Those are false contractions. Those contractions are not painful. They don't last as long as a normal contraction. So when you feel like you feel some contractions, some tightening, that's not when you carry your bag, you are going to the hospital, but you just waste transport.
People have been saying that when I was having like real contraction, I was thinking it's false. So when I started having it on Tuesday, And then I waited, and because my appointment was on Friday, it got intense on Thursday, and then I was like, let me wait and go on Friday. But it was just, but I was like, these people will say it is that's it.
Braxton Hicks.
I
it's
said,
a big
wait. When I went 4 centimeters or something,
yeah. But the thing is that true contractions are painful and they are regular. Like it counts.
You see, because of the way people have been saying it, and you are expecting like some tag of war and stuff. So I was expecting.
The true contractions are like contract, hold, and then relax.
And that feeling is so nice.
And then relax. But Braxton Hicks, the true contractions too are painful. Like they're painful. But Braxton Hicks, it's not painful. You just feel some small contractions, and they are not regular. True contractions are regular. Braxton Hicks are irregular. So just one tightening, and then relax for hours, then another contraction. But those ones are not. Other fun facts is that from your initial pregnancy till 28 weeks, from that time the child is not viable. As in, so if you give birth before that time, the child is like most likely to die. But then this is in Ghana, so the period of viability in Ghana is 28 weeks. But then in the US and other countries, you can have 26 weeks, 24 weeks, and because they have better systems of taking care of the child. Exactly. But in Ghana, 28 weeks. When you give birth at 28 weeks, we can support your baby to survive.
Now I'm going to answer the question some of you asked before, because I posted on my YouTube. I posted on my WhatsApp story that you guys should ask questions, so doctor will answer for you. So these are the questions you guys asked me. The first question is, can I test positive at home and negative at the hospital?
Okay, so that is possible, though it's not very likely. The reverse is actually more possible, where you test negative at home and then positive at the hospital, because as I said earlier, the hospital has more sensitive tests compared to the test kits. And the test kits, what they are testing is something called BCG in your urine, and that's the levels of BCG increase as you progress with your pregnancy. So it's likely that by the time you tested negative at home, your levels were not that high, but when you got to the hospital to test later on, maybe a week later, then it became positive.
Yeah, they are saying, the person said,
so I'm saying it's not likely. So the reverse is more likely. But it's also possible, because some test kits can be false, as in faulty.
Okay, so if I give birth at 36 weeks, is my child considered premature?
Okay, so as I said, the normal pregnancy is from 37 completed weeks to 42 weeks. So if your child is 36 weeks, that is preterm. And then there's premature. Premature is before 36 weeks.
Before the 37 is the preterm.
Okay. But it's all preterm. Okay. So like premature, you can say it's a subset of preterm, I think.
Yeah. Then the next question is, what kind of food boosts fertility?
Okay, so there's no scientific proof about like foods that would boost your fertility, but there are foods that would boost your general well-being, ability to carry a child, and all those things. So I don't think there are foods that would boost your fertility, like chances of getting pregnant. But then when you get pregnant, there are foods that will support you to maintain the pregnancy and carry it to term. So those are what we talked about in the video.
So the next question is, what should I do to stop morning sickness?
So morning sickness is, we have severity. So morning sickness is actually caused by the BCG that I told you about. Okay, that's what makes you feel like throwing up. So the higher the levels, the higher you and for morning sickness, you generally would want to avoid the things that cause the things that trigger your morning sickness, because we don't really give we call them antiemetics. Those are the drugs that stop vomiting. We don't really give antiemetics for morning sickness unless it's very severe. Okay, that's when we give it. But if it's normal, you just want to avoid those things that make you nauseous.
Okay. The next question is it possible for me to be spotting throughout my pregnancy?
Okay, so spotting can be normal in the first trimester, but then when it moves to when you experience spotting in your second and third trimester, it's not normal, and those are danger signs for something more serious, like your placenta sharing off. That's called placenta abruption. Okay, so those ones, when you see spotting in your second and third trimester, you should see a doctor, because it could be something severe. But the first trimester is fine.
Okay, so how do I know if I'm fit for a vaginal birth or CS?
Okay, so for vaginal deliveries and CS, I think that's under labor and delivery. So
we have to shoot a whole video, depending on how this video goes. Like if you guys love it, we'll do the labor and delivery. But then please answer the question.
Okay, so for vaginal delivery, it depends on so many factors, and the first factor is the size of the baby. So some babies' heads can be very big.
But why I laugh?
Some babies' heads are big. That's why I say when you're looking for a husband, look at his head. Yeah, so but that's just by the way. So the size of the baby's head. So there's your hip bone is called your pelvis, and it's because it's a bone, it's a fixed diameter. Okay, and there are different types of pelvis. There are actually 4 types of pelvis, and this is like very deep. So every woman has a different type of pelvis. Okay, so if the baby's head is not able to fit through the bone, okay, and now pass through, because it enters the pelvis and now before it gets into your vagina and comes out. Okay, but if it can't pass through the pelvis in the first place, you can't have a vaginal delivery. So that one they have to operate, and that's called cephalopelvic disproportion. So cephalo is head, pelvic is your pelvis, then they'll say disproportion. So if they say you have CPD, it means you can't have a vaginal delivery, you have to have a CS. Exactly.
So what if you have that and you still want a vagina?
You can't, because it can't pass through the bone, and we can't break your bone. I mean, in the olden days they used to break bones, but then we don't do that. Those are crude methods. Anyway, so the next thing is if you have comorbidities. As I said, if you have preeclampsia, that's increased blood pressure. If you have high levels, you don't allow vaginal delivery. If you have had a previous cesarean section like 2 or more times, you don't allow vaginal delivery, because then your where they cut is now weak, and you need a lot of pressure to push the baby out. So you don't want to weaken that area. So if you have had 2 or more previous CSs, you don't allow you to have a vaginal delivery at all. And also if from your antenatal scans you realize that your baby has some defects like hydrocephalus. Hydrocephalus is when the baby's head is very big, is filled with fluid. You've seen those babies with very large heads. Okay, so they can detect it through scans. So you can't push that out, so they have to do a CS. And also the weight of the baby. If the baby is too small, you can't push it out, because you need the weight of the baby to push out. The baby needs some weight to come out of the vagina. If it's too light, imagine you can't push something very light out. So aside the energy you're using to push, you need the weight of the baby to also. So if it's too low, you can't push it out. You need to be serious. Exactly. So.
Okay. The next question. This person said, I want to take a concoction. It's a mixture of bay leaves, cinnamon, and lemon. I haven't given birth yet. I want to know if that can delay pregnancy or block the womb. And the person went further to say, I want to use it because I learned it's the easiest way to burn belly fat.
Oh, okay. So this concoction, there's no scientific backing to it that said it can delay your, what's the question? Can delay what?
Delay pregnancy.
It can delay pregnancy or block the womb. You know, you can take it because it contains lemon, which is good for your health, cinnamon, which is good for your health, bay leaves. But then whatever you're taking during your pregnancy, you have to consult your doctor. So you can take it before you get pregnant, but during your pregnancy you can just ask your doctor, because there are so many constituents in that, and you have to find out. But before your pregnancy you can take it because there's no.
So the last question is, how can I tell if I'm fertile or not?
Okay, so this is actually very difficult to test, but then there are various tests, like biological tests you can do to see if biologically you can have a child. That's to test if you are ovulating, and to test if your reproductive tract is patent. That's if you have your fallopian tubes are open and they are not blocked by any previous disease you may have had. But aside that, as to whether you actually conceive is very difficult. So unless you try and fail, that's when you know that you are not fertile.
Oh, okay. So I think that's just the end. Thanks so much for coming, and I would love to say, if you have anything, any question, any suggestion, any of your experience, let us know in the comment section down below. I'll forward them to her, and then if you are not clear about something, just let me know in the comment section. I'll do that and then get you through Instagram or something, and then give you your feedback. So thanks so much for
coming. You too.
See you in our next one. Bye.